considerable evidence has indicated the importance of physical activity and cardiorespiratory fitness for many chronic health outcomes, including and particularly cardiovascular disease. And my colleagues and I have published a number of papers on this, including many papers in the Mayo Clinic Proceedings over the last several years. But there's also considerable evidence that muscular strength, muscle function and strength also play an important role in cardiovascular disease. And just for example, in 2019, we had a paper with David Jimenez Pavon that showed that muscle strength was very protective against sudden cardiac death. This was data from the Aerobic Center longitudinal study. There was another paper in 2019 where we showed that muscular strength by Wang and colleagues, also from the Aerobic Center longitudinal study, was very protective against the development of diabetes. And one of my close colleagues, Dr. Salvatore Cavoni, who's published a bunch in the Mayo Clinic Proceedings, we just had a major paper in the top cardiac rehab journal, Journal of Cardiac Rehabilitation Prevention, talking about the importance of muscle strength and protection against all cardiovascular diseases. I'm Dr. Carl Chip Levy. I'm Medical Director of Cardiac Rehabilitation and Preventive Cardiology and the Director of the Exercise Laboratories at the John Ochsner Heart and Vascular Institute, Ochsner Clinical School, and the University of Queensland School of Medicine here in New Orleans, Louisiana. I also happen to be the editor-in-chief of a major cardiology journal, Progress in Cardiovascular Diseases. And I'm also associate editor, one of the associate editors and cardiovascular section editor of the Mayo Clinic Proceedings. But I'm here today to discuss our new paper, which is entitled Inverse Association of Hand Grip Strength with Risk of Heart Failure, which is published online now in the Mayo Clinic Proceedings and will be in the June issue. I'd first like to acknowledge and congratulate the excellent efforts of my co-authors on this paper, particularly the first and lead author, Dr. Jerry Lucanon, who's one of the most famous preventive cardiologists in Europe and probably in all of the world. And he's had a number of other papers in the Mayo Clinic Proceedings as well. And also especially the last and senior author, Dr. Sitar Knutzer, who did an excellent job during all aspects of this paper and during the review process. We basically studied hand grip strength in a cohort of 770 men and women from the Finland Kuopio Ischemic Heart Disease Project, and followed this group for a period of 17 years. And during this time, there were 177 heart failure events. And we basically showed that for every 1 standard deviation increase in hand grip strength, there was a 27% reduction in the risk of heart failure events. And in fact, when we analyzed those who were in the top tertile, the top third of hand grip strength compared to those in the bottom tertile, the top tertile had a 45% lower risk of developing heart failure during follow-up. So this data really suggests that hand grip strength, which is a marker of muscular strength, is very protective against cardiovascular disease and specifically heart failure in this study. And so we concluded that it would be quite reasonable to use hand grip strength to assess the risk of subsequent heart failure in populations. But probably taking it a step beyond this is that efforts to improve hand grip strength and muscular strength would also probably go a long way to protect against cardiovascular disease and specifically heart failure. Now, we know that there is certainly a genetic component of cardiorespiratory fitness. The main thing that leads to higher levels of cardiorespiratory fitness is, of course, physical activity and exercise training. But just like cardiorespiratory fitness, there is also a genetic component for muscular strength. Some people are just naturally stronger than others. But by far, the major way to improve one's muscular strength is doing some resistance exercise. And just for example, in 2017, Esme Baker had a paper in the Mayo Clinic Proceedings, also from the Aerobic Center longitudinal study with me, that showed that resistance exercise, just 1 or 2 times per week, dramatically reduced the risk of developing metabolic syndrome. And in a paper that Esme Baker and I had in 2018 Mayo Clinic Proceedings, we again showed that just doing 1 or 2 times per week of resistance exercise markedly lowered the risk of hypercholesterolemia. But probably one of our best papers on the resistance exercise has recently been published 2 years ago in MSSE, Medical Science, Sports, and Exercise, which is our major exercise journal in the United States, and also taking data from Wang and colleagues from the Aerobic Center longitudinal study. We showed that muscle strength, which was obtained from doing resistance exercise, that the resistance exercise was associated with quite significant reductions in cardiovascular disease mortality, as well as all-cause mortality. And it was independent of physical activity and cardiorespiratory fitness. So the constellation of data, including this paper in the current issue of the Mayo Clinic Proceedings, certainly suggests that muscle strength is something that's also very important in this paper to protect against heart failure, and in a constellation of data to protect against cardiovascular diseases. So we certainly should be recommending all of our patients to be physically active and to do 150 to 300 minutes a week of aerobic exercise and physical activity. But in addition to this, the guidelines also suggest that all adults should be doing 2 to 3 times per week of resistance exercise. And our data actually shows that just doing 1 or 2 times per week of resistance exercise seems to produce maximal benefits. So doing resistance exercise and therefore improving hand grip strength and muscular strength would go a long way for the protection against the development of metabolic syndrome, diabetes, hypercholesterolemia, heart failure, as well as all aspects of cardiovascular diseases. So this also needs to be emphasized in the prevention and treatment of cardiovascular diseases. Thank you very much. I hope this information is of interest and helpful.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.